Welcome to the Wellness on Purpose podcast, your go-to source for impactful, educational, and realistic information designed to propel you forward on your journey to intentional well-being, not just for today, but for the well-being of future generations. Join us as we dive into insightful conversation with industry and brand leaders in the ever-evolving landscape of the health and wellness industry. Discover the latest trends, gain valuable perspectives, and uncover practical tips to elevate your wellness journey starting today. This podcast is brought to you by Joanne's Place Health Foods, your trusted partner in health, located in the heart of Peterborough and Lindsay, Ontario. I'm your host, Marissa Laughlin, and I'm thrilled to be guiding you through this season of the Wellness on Purpose podcast. Hi, everyone. Welcome back to the Wellness on Purpose podcast. I'm so happy to be here today and talk to you about some groundbreaking technology that is really taking the health and wellness industry by storm, and that is Lipomicel supplementation. When you're taking your supplements, can you imagine unlocking their fullest potential to help you get more out of every single dose, getting you better faster, and making sure that every single pill and drop of formulation in that pill is absorbed the best it possibly can? Yeah, me too. Also, doing it at an affordable way. Very important, especially this day and age. Now, that's exactly what Lipomicel technology is promising. So I wanted to have somebody come on to this podcast and talk about what this technology actually is and if what they're saying it does actually works. So in this episode, we're going to be breaking down what that technology is, talking about the incredible absorption benefits, so they say, and talk about why this is the new way of supplementation. Also going to be diving into talking about the top researched supplements in the industry today, which is glutathione, vitamin D, berberine, and quercetin. Anyways, I want to jump into it and welcome today's guest onto the podcast, a new guest that we've not had before. This is Dr. Jennifer Brix. Jennifer Brix is a licensed practicing naturopathic doctor, health educator, and public speaker with a passion for empowering her patients to achieve optimal health. As an expert in treating digestive complaints, hormonal imbalances, and brain-related health conditions, Dr. Jen shares her knowledge by training health industry retailers and educating the public on these topics and other areas of interest. So without further ado, join me in welcoming naturopathic Dr. Jennifer Brix onto our podcast today. Hello, Dr. Brix. How are you doing today?
I'm great, Marissa. How are you?
I'm good, thank you. Thank you so much for joining us on the podcast. I am really excited about today's conversation because this is actually something that I don't know a whole lot about. And honestly, I've been in the health and wellness industry for over 10 years. And this is what we're going to talk about today is kind of new, at least in my eyes. So I'm excited to learn a little bit more about Lipomicel formulas from you and just kind of talk about what that is. Because I feel like it's also starting to become this trendier word that we're seeing. Same with liposomes. So I'm excited to dive into today's topic. So let's just get right into it. And I would love to start with just talking about the basics. What is Lipomicel and why was this designed for supplementation?
Yeah, so Lipomicel, it's a technology. It's patent pending, and it was developed to encapsulate or to envelop nutrients that are really difficult for the human body to absorb. This is always the issue with supplements, right? It's not how much you take, it's how much you absorb if you want to have a therapeutic effect. So Lipomicel basically consists of micelles, which are small phospholipid bubble-like structures, and inside they contain the desired nutrient.
Okay. So this type of technology, you would say, helps to increase the absorption, or does it work in another way?
It definitely increases the absorption because it is encapsulated, so it protects the nutrient from degradation. But because lipomicelles are also smaller than your typical other encapsulation, it can be absorbed across the intestinal layer much more easily and then eventually get into the cells where we want it.
Amazing. And for me in particular, I love that because I myself, and then also I'm a nutritionist, so with clients, I see so many gut issues and they have trouble absorbing nutrients. So I feel like this would be a great technology and support for supplementing with. But what is the difference between liposomal and lipomicelle? Are they the same or are they different?
Yeah, so liposomes have been around for a little bit longer. It's another form of delivery system. Actually, I think it's been around for over a decade, and I believe it was originally introduced to help get medication, pharmaceuticals into the body. But of course, liposomes can also carry nutrients. So the difference between the two is that liposomes, the way they're structured, generally only carry water-soluble nutrients. So things like vitamin C. You see liposomal vitamin C around on the shelves. But they're also much larger than micelles or lipomicelles. So the absorption of their contents can be limited by their large size. In addition, sometimes synthetic compounds and detergents are used in the manufacture of liposomes, but lipomicelle products are composed of only natural food grade ingredients. So that's the main, I guess, would say the main difference between those two.
So interesting. I think we forget about manufacturing of ingredients for supplements. It's actually like this gray area that, not all brands are transparent about, or we don't even take into consideration like solvents and different agents that need to be used to extract different ingredients. So that's really interesting and a very good point. Now, you quickly mentioned about increased absorption and the benefits of that for using lipomicelle formulas, but can you just list off some big key benefits that people would see by choosing a lipomicelle technology formulated supplement versus just like an everyday regular supplement?
For sure. Yeah. So I mentioned quickly that liposomal products carry generally water-soluble nutrients. Lipomicelles can actually carry both fat-soluble and water-soluble nutrients. So you're going to see a lot more in terms of variety when you see products coming out with this technology. Of course, the additional benefits would be that it is smaller, so you get increased delivery and bioavailability of those nutrients where you want them. They're improved in solubility and stability, so they can be very stable in low pH, which is in the stomach, or even a high pH, more into the intestinal areas. So they won't have that degradation occurring. It's also, it can protect itself against metabolism by gut bacteria and enzymes. So it's strong and will remain intact that way. It tends to have a longer half-life in the body. So it becomes, you take a supplement and you see that benefit for longer. You don't have to use a higher dose because it's more absorbable. You can take less of a product, which saves money. And of course, because there's no concern about increased breakdown and effects elsewhere, we have fewer side effects than some of the standard nutrients that we would consume.
Oh, good point about dosage, because we know that the faster we absorb something, it could be at more of a rapid pace. And so I'm going to assume that most lipomicelle formulas are that lower dose because of that benefit. But is there any major side effects that we should know about and let our customers know about lipomicelle products that could happen for them?
Yeah, no, so there are no side effects that have been noted in any of the clinical trials with lipomicelle products. They're gentle on the body without any kind of unwanted irritation in the GI tract. Some nutrients will have side effects, and taking too much of any nutrient can cause that. So there'd still be that involved. If you had an allergy to, say, quercetin, taking a lipomicelle quercetin is not going to prevent that allergy. So you still have to be aware of what may or may not work for you from the nutrient standpoint.
Absolutely. And we always say on this podcast is definitely check with your healthcare provider before taking any type of formulation, because it could be very dependent on if you are taking other supplements or other drugs or just even what your lifestyle is. So I always like to put that disclaimer as well. But back to the conversation about proven research. So does the lipomicelle technology actually have scientific proof of its claims, or is this what we are projecting is actually occurring?
Yeah, it absolutely does have proof. There's been a lot of different research studies that have taken place with this type of technology. Things always start in vitro, right? So looking at the level at the cells and in a test tube. So that kind of research was first done. The human body, the environment of the human body was reproduced in the lab, and measurements were taken to determine how quickly the product broke down and was absorbed across like an imitation intestinal media. So that was done in the very outset. And then other in vitro research includes cell studies to measure permeability and absorption, as well as interactions, toxicity, and safety. And then they also looked at characterization studies of lipomycel particles to really assess the size and the morphology and how that may impact the human before that actually those trials were done. So after that, clinical research was followed, and that was human clinical trials looking at bioavailability as well as safety. So lipomycel formulations were compared with standard products as well as, liposomal and other competitor formulations to observe how quickly and how much those nutrients were absorbed into the bloodstream, as well as monitoring for any adverse events or side effects of the lipomycel formulation. So they looked at everything possible. They covered the cell studies, the in vitro, and all the way to human to be able to, have the health claims that we see with these products.
Wow, so impressive because we know it's important to see the research and the scientific proof, but also when it's something that's so like new to the industry, it's just great to see that there's still research being done. So I love that. Now, when we talk about absorption of lipomycel products and supplements and the technology behind that, are there other types of compounds that deliver through this technology, or can you dive a little bit deeper into the delivery system?
So because it delivers both fat-soluble nutrients and water-soluble nutrients, you'll see a vast number of different formulations on the market. So some common fat-soluble nutrients that can be very hard to absorb include quercetin, and even vitamin D. So those are two that we see with lipomycel delivery. And then water-soluble nutrients like berberine, which is a very popular one right now. And then also polar compounds. So those are things that have both water and fat-soluble components. That good example of that would be glutathione. So that's where we see the supplements coming up onto the market would be those four main nutrients.
Yeah, those are definitely the most popular ones. I would say I think every healthcare practitioner is currently talking about at least one of those. So I'd like to dive a little bit deeper into kind of each of those. Let's start with quercetin because we've talked a little bit about that already. And I think this time of year is really important for quercetin because, we're looking at seasonal allergies, boosting immune system, talking about liver function. So those are some things off the top of my head I think about with quercetin. But what are more of the main benefits of taking quercetin when it's specifically formulated in that lipomycel technology?
So when you see it in lipomycel technology, of course, first of all, we look at, well, it's more absorbable. Studies have actually shown that lipomycel quercetin is 10 times more absorbable compared to standard quercetin, and levels seem to stay and accumulate in the blood for longer. So you don't have to take as much. It also seems to be absorbed twice as fast. So you may get like a more speedier result, especially if you're looking at allergies. And that was compared to a phytosome delivery method, which is better than standard, but it's still not as good as the lipomycel from that particular study. So quercetin, which generally comes from the plant Sephora japonica, is an antioxidant. We know it's very specific to supporting blood vessel health, so cardiovascular function and the endothelial layer, immunity, as you mentioned, of course, and allergies. So with quercetin being packaged in the way it is with lipomycel, you can take less to support those mast cells. Mast cells are the cells that contain histamine. And if you can stabilize those mast cells, you're not going to get that release of histamine when you are exposed to an allergen, whether it's seasonal allergies like pollens or even moving into fall, we see a lot of mold and spore allergies that come up. So stabilizing those mast cells is very key to prevent those symptoms from even beginning.
Amazing. I don't know anyone that doesn't have a little bit of a seasonal allergy, even if it's just like the scratchy throat. So I think I think quercetin's a really great ingredient just to help with that. But overall, it's an antioxidant, many other benefits as well. Let's stick with the fat soluble vitamins. And I want to talk about vitamin D because that's another huge, very well known vitamin. We've seen it for years and years and years be so supportive for immune, many other things. But can you remind our listeners how important is vitamin D? Do we need it?
So vast majority of Canadians have suboptimal levels or are deficient. Vitamin D is very important for a few things that we know of. So obviously when you have it combined with calcium and vitamin K2, it really supports bone health and helps to prevent and reduce that risk of developing osteoporosis. Vitamin D is also involved in immune function. So looking at cold and flu season, as well as autoimmunity, we see higher levels of autoimmunity with deficient levels of vitamin D. And it's the sunshine vitamins, the happy vitamins. So it's also involved in things like mood.
Yeah, so many aspects that it touches. And I want to just highlight here to our listeners, don't wait to start vitamin D until you're in the thick of the cold season. Like I'm saying, start now. If you are, we're already starting to see here in Ontario, less sunny days, colder temperatures. So this would be the time to start to, if you've taken a break over summer, to start to increase that vitamin D. But in particular, it might be best to consider the Lipomicel technology because do we think that this would increase absorption of vitamin D levels in the body, or what are your thoughts on that?
Yeah, so the clinical trial that was done with vitamin D and Lipomicel was just recently published about a month or two ago. And what they found, it was a double-blind randomized human trial. And what was found was that vitamin D compared to standard vitamin D over 60 days had a 7 times more absorption rate. So it raised vitamin D serum or blood levels by up to 7 times. So in other words, if you're taking 1,000 IUs of vitamin D, if you take it in the Lipomicel form, it could be equivalent to taking 7,000 IUs, which, a lot fewer pills and maybe a little bit easier for compliance for people to help raise their levels.
Absolutely. That's so good to know. Quick pause in today's episode because I want to talk to you about a transformational online program. In case you missed it, Joanne's Place released an online program called the Wellness on Purpose Program to Educate You last year. And our intention with this program is to make this education more accessible for our community to better support their wellness journeys. This program promotes sustainable and realistic changes, and it really focuses on the foundational pillars of every single person's health: your nutrition, your sleep, your stress, and also movement. If you want to get started today, click the link in the description below to learn more about the Wellness on Purpose program and to get started today. By the way, it's completely free and you can move at your own pace from the comfort of your own home. Now let's talk about the water-soluble vitamins, the beloved berberine, because this is quite literally flying off the shelves. It's a great formulation, great herb, very supportive. But when we're looking at Lipomicel technology for berberine, do we feel that this is supportive for managing blood sugar levels so far?
Yes, so it has the same actions as standard berberine in that it supports GLP-1 and AMPK. Those are those important enzymes that help to manage healthy blood sugar as well as sensitize insulin and help with weight loss and all those associated things with metabolic syndrome. But because it's in the Lipomicel technology format, clinical trials have shown that there is a threefold higher concentration noted in the blood when taking it compared to standard berberine. So 3 times more absorption for that. And then follow-up studies when you take even more, so at 500 milligram dosages or higher, you're seeing up to 6 times higher absorption than standard berberine. So again, you're going to get more bang for your buck. You're going to get more therapeutic value. And also, it's going to be a safer product. It's going to have less side effects in terms of irritation in the GI tract, which some people can get. So gastrointestinal side effects, looser stools or irritation or cramping and things like that can happen in some people who take standard berberine.
Yeah, good to know. That's one big side effect with berberine is the GI upset when taking at high doses. So good to know about the Lipomicel technology to support that, especially if you are somebody with a sensitive stomach. But when we talk about seeing results of berberine for different health conditions, I mean, we see it now as blood sugar regulation, helping with weight loss. But would you expect the results to come quicker with this type of Lipomicel technology, or would it be the same as the traditional berberine supplements?
Yeah, at first glance, you think, okay, it would be, take the same amount of time, but the clinical trial actually showed that it was effective in lowering blood sugar levels by 12%. in as short as 2 days. So again, all of these amazing things that we're seeing with this research coming out, just to, again, bolster this type of technology.
Amazing. That's awesome. Okay, I want to talk about one more key ingredient. This is my probably favorite type of ingredient to supplement with for myself, but also I see a lot of people using it for different modalities. But glutathione. What are the benefits of glutathione when it is in a technology like the Lipomicel? Is it the same as traditional, or like what would somebody gravitate towards picking this formula for glutathione?
Mhm. So I can get into the benefits of glutathione. Glutathione is our master antioxidant, right? So it supports detoxification pathways in the liver and outside of the liver. It supports the reconstituting of other antioxidants in the body, like vitamin C and vitamin E. It's involved in healthy aging. It's especially important for men, actually, as levels in men deplete more quickly than in women. So, something to think about for the guys out there. And also, really important for anyone who has exposures to toxicities in their environment, right? So, this could be anything from your workplace to foods that you're maybe eating that aren't super healthy for you, having too much sugar, too much alcohol, too much caffeine, right? So glutathione is really great to help kind of quench the damage from our lifestyle factors that impact health. And when we packaged it into lipomicel technology, clinical trials showed that, again, it was more absorbable. In this case, it was 2 times more absorbable than standard forms of glutathione. So again, taking less or getting a therapeutic result much more easily than taking a standard form.
Amazing. I want to take all of these right now. I mean, I normally take several of these like quercetin and vitamin D and glutathione. I usually cycle on and off glutathione, but there's just been so much interesting research around berberine, not just for, weight loss, but looking at blood sugar regulation, helping with PCOS. There's the different hormone functions. So all of these key nutrients are definitely a big conversation in the health and wellness industry right now. But I would say, in summary, what's really important to talk about is actually the absorption factor. Like, you're consuming these supplements, you're paying money for these supplements. Are you actually consuming them, digesting them, and absorbing them? And based on this conversation today, you're saying that the Lipomicel is a really great technology that's been put in place to help ensure that you are actually absorbing those nutrients, which is just so important.
Absolutely. I think I want to just mention that in my practice, I see a lot of patients with GI concerns, like you have said. And gut health is like pivotal in any kind of treatment plan. It's foundational. But if someone needs to get a benefit from a supplement before we can fully heal their gut, lipomicel products are a great option because we're bypassing that concern of poor absorption. And it's also a safer product because of the safety studies we see that there are no adverse effects with these products, which is also a really big bonus.
Yeah, absolutely. I'm so glad you brought a point to that, because there are some people who think they need to heal everything before they can have other nutrients put into their regime. But having it the right, dosage, right technology can be really helping you progress in that healing and supporting the body without having to, make sure the gut is perfect, because it's very hard to do.
Yeah.
Amazing. Awesome. Any last words of advice for our listeners in regards to lipomicelle technology and choosing that as a supplementation technology for their next purchase?
I just reiterate that, you are what you eat, you are what you absorb, and you are what you don't excrete. So again, lipomicelle products are helping you with at least one of those factors and allowing that absorption of those nutrients to, again, reap those benefits, but also save a little bit of money in your pocket too.
Yeah, save a little bit of money. That's big these days. I mean, should always be a factor, but more than ever. So,
Mhm.
thank you so much for sharing your insight and your knowledge today on the podcast. It's been greatly appreciated.
Thanks, Marissa. I'm glad to be here.
Hold up. Before you go, I wanted to do a quick recap of some key information that we touched on in today's episode. As Dr. Jennifer Brinks mentioned, the Lipomicel technology is a patented formula, and this is a patented formula from Natural Factors. Natural Factors is a Canadian company. They have been in the health and wellness industry for a very long time, and they know what they're doing. So what we talked about today, we really learned about the Lipomicel dramatic effects that it has on enhancing the absorption of key nutrients and ensuring that your body gets the most out of every single supplement, while keeping in mind the cost of supplements and how much that this formulation and technology really is a powerhouse for those key ingredients that we know a lot of you are looking for right now. We talked about glutathione, vitamin D, berberine, quercetin. Those are some really key foundational supplementations we see a lot of people taking. And if you've been taking it for a long period of time, but maybe want to switch something up, changing to a Lipomicel formulation might be the next step for you. So as a recap on those key ingredients, glutathione lipomicel is perfect for those who are looking for a boost of antioxidants defense and supporting overall detoxification. Vitamin D lipomicel is a must for pretty much every single person who's listening to this podcast, whether you're looking to focus on bone health, immune function, mood regulation, you're really trying to make the transition into the darker, longer days. This is what you need, vitamin D. It's key. If you're somebody who is looking at your metabolic health and managing your blood sugar levels, you're looking for that berberine lipomicel. This is going to be really pivotal in your day-to-day routine with helping to manage that blood sugar, possibly seeing a change in weight, and helping to maintain that healthy metabolic function. And lastly, we talked about the quercetin lipomicel, which is really great for helping with immune response. It has anti-inflammatory benefits, and it's really good for people who suffer with seasonal allergies. So if you are ready to experience the difference of the Lipomicel formulations and really try to progress yourself along your health and wellness journey, please pop into one of Joanne's Place locations. We have these formulations available, and our staff would be happy to talk to you about whether or not they are the fit for your supplement regime. Thank you for joining us for another insightful episode of the Wellness on Purpose podcast. We hope you found the information valuable and inspiring to support you along your wellness journey. Before we go, a quick reminder. The content shared in this podcast is for educational purposes only. While we strive to provide accurate and up-to-date information, it's important to remember that everyone's health journey is unique. We strongly recommend consulting with your healthcare professional or a qualified health practitioner for personalized advice tailored to your specific needs and circumstances. Your well-being is a priority, and speaking to a healthcare professional ensures that you receive guidance that best aligns with your individualized health goals. If you have any questions or topics you'd like us to cover in future episodes, please reach out to us through our website. That's all for now. I hope you stay well, stay informed, and remember, your health is your greatest wealth. Until next time, take care.